Well, hey guys, today we're talking about nebulizing hydrogen peroxide for respiratory health. So many of you guys have reached out to me and asked me about this. And so I wanted to put together a detailed presentation on nebulizing and different things that you can utilize, including hydrogen peroxide. So we know hydrogen peroxide, the chemical structure is H2O2. It releases a negative oxygen ion that breaks the integrity of the cell membrane of bacteria, fungi, and other pathogens. This kills the pathogens and reduces the microbial load in our body. Our immune cells also create hydrogen peroxide as part of their defense against pathogens in the body. And so this is what is happening on a regular basis inside of our body. So hydrogen peroxide releases oxygen when applied to affected areas. And that can also cause foaming. So like when you put it on skin to disinfect, that the oxygen release is actually what's causing that foaming. And that's because the blood of most living cells contains the enzyme catalase, which attacks hydrogen peroxide and converts it into water and oxygen. The free oxygen radical has a negative charge that interacts with pathogens and damages their cell walls. This helps to destroy bacteria, clean areas, and remove dead skin cells. Your white blood cells make and use hydrogen peroxide to fight bacteria, viruses, fungi, and other pathogens every single day. They're constantly doing it. And of course, hydrogen peroxide has a long history of use. And so many people are using it, obviously, to disinfect wounds, help reduce acne, improve oral health. It can help clean up mold, whiten teeth, actually, right? You can actually brush your teeth with it because, again, it's going to break down the bacteria there on the mouth. It's good for, you can dip it in if you have toenail fungus for helping reduce toenail fungus. You can put it on fruit and vegetables to help get rid of bacteria. It's not necessarily going to get rid of pesticides, but it will get rid of bad bacteria. So reduce your risk of, a salmonella infection or something like that. And you can use it to improve your respiratory health by nebulizing it. It also turns out that friendly bacteria in the mucous membranes of your lungs, your sinuses, your nose, your mouth, your digestive system, and urinary tract thrive in environments that are rich in oxygen. And so hydrogen peroxide is very high in oxygen, which again may help the friendly bacteria. So that's a great thing about it. It can actually help the good bacteria, the aerobic bacteria, but it will help get rid of the anaerobic or bad bacteria and cause them to die. And so when we look at nebulizing, nebulizer is a piece of medical equipment that changes certain medications or therapeutic supplements from a liquid form to a mist of aerosol droplets that allows you to inhale it into your lung. And this allows you to have improved absorption into your respiratory system. It acts quicker. So a lot of like asthmatics, for example, use this to get steroids into their lungs to dilate their lungs if their lungs are constricted and they can't get oxygen in. So nebulizing can be really powerful. It's been used for a long time to help treat respiratory infections. And, in particular, they're nebulizing steroids, usually some sort of kind of a breathing treatment to help open up the airways is usually how it's used in the medical system. But you can also use things like hydrogen peroxide, very simple, very inexpensive. And I'm going to go through how to use it properly. But the benefits of nebulizing hydrogen peroxide, it actually improves, of course, your respiratory health, but also helps knock down oral pathogens, which are a really common cause of digestive issues and respiratory issues because we're constantly swallowing pathogens from our mouth. In fact, there's a book, Hidden Epidemic, by Dr. Thomas Levy, who's one of the foremost experts when it comes to nebulizing hydrogen peroxide. He's been one of the forerunners in really getting this information out. And he discussed the role of hydrogen peroxide in his book, Hidden Epidemic, for acute viral respiratory infections. He also talked about how it will help break down the biofilms by disease-causing colonies of different microbes in your sinuses, right? So you actually, when you nebulize, you want one kind of like what this picture is showing that goes over your nose. So it gets up into your sinuses, not just into your mouth. A lot of asthmatics will just use it in the mouth because they're trying to get it into the lungs, but you want to use it where it's getting into your sinuses as well. It's super important. And, a lot of people have chronic infections, right, in their tonsils and in their oral cavity. And those pathogens, again, they get swallowed. The ongoing infection may compromise the health of your gut because they get into your digestive system between meals when your stomach acid is, not kicked up. and they can cause bacterial overgrowth and a lot of different problems. In fact, if you have like a recurrent or a H. pylori infection that's shutting down stomach acid production, it's just not going away, even though you've been treating it with, antimicrobials and other things. It's oftentimes an issue going on with your mouth. We see that with SIBO as well, small intestinal bacterial overgrowth. So the hydrogen peroxide, nebulizing it, can actually help keep that microbial load down by doing that on a regular basis. And so how do we prepare the hydrogen peroxide for nebulizing? Well, this is kind of the general recipe, and I'll give you ratios of how much hydrogen peroxide you want to use with water. But we like to start with about 2 teaspoons of 3% food grade hydrogen peroxide to 8 ounces of saline water. Now, if you don't get the food grade, there are some stabilizers in there, but if you do this dilution, it overall should be safe, but the food grade will just make it purer and cleaner. Although, again, a lot of people have used kind of just the store-bought, 99-cent variety that they buy at Walgreens, but the food grade is better. So you do that, and you do that with saline. Now, how do you make saline? Well, you can make your own by just taking a half a teaspoon of sea salt in 8 ounces of purified water, stir until the salt is dissolved. So that's it, pretty easy. Now, if you're starting with a 12% hydrogen peroxide, then you only put a half a teaspoon of that in 8 ounces of saline water. And again, I'm going to give you the ratios here in just a second. Of course, you transfer that mix to a glass dropper bottle, ideally like a dropper bottle or like a bottle that has kind of a dropper to get in the right amount. You don't necessarily have to, you can eyeball it as well, but you want to use about 2 to 3 ml, right? So when you get your nebulizer, and I actually have a link to a good nebulizer under this video, so check that out. There's a link for the right type of nebulizer, or if you're listening to this on podcast, just find this article, Nebulizing Hydrogen Peroxide, and I have the link in there, just right on my Dr. Jockers site, for a great nebulizer that you want to use that works really good. Okay, so you don't want to mess around and get a cheap, bad nebulizer. You want to get the right one. So check that out. Use about 2 to 3 ml or about half a teaspoon of the mix for each nebulizing session, and you can keep that solution refrigerated for a long time and continue to use it. Do you mix it up? Yeah, I usually will mix it up, right? So if you keep it refrigerated for a while, just kind of mix it up. Sometimes the salt might, come out of the solution, and mix on the bottom or something like that. So just kind of mix it up and then reuse. So proper dosing for 1% hydrogen peroxide nebulization, which is what I've found now to be the most well-tolerated. Some people will do like a pure 3%, but I found that the 1% seems to be the most well-tolerated. Obviously, you can dilute it even more. It's not going to be as potent, but also if you're noticing like any sort of burning in your throat, right? Or if it's like inducing a lot of coughing when you're doing it, you might want to dilute it down just a little bit more. Okay. And this is best to do early on, right? You want to do this early on, like the moment you have symptoms, respiratory symptoms. As you get deeper into the illness, it's not going to be as effective. But if you do it early on, then it's very, very, very effective. So as you start to notice, you're sneezing, you're coughing a little bit, you have a sore throat, get on this. Okay. And so just have these ingredients at home so you can get started with it. But basically you're starting with, if you're starting with 3%, which most people are, 1 teaspoon hydrogen peroxide per 4 ounces. I had mentioned 2 teaspoons for 8 ounces to make kind of like an overall solution. Obviously you can do 1 teaspoon and 4 ounces of the water or saline, right? And that will give you 1%, if you're doing a 12% concentration, about a 1/4 teaspoon of hydrogen peroxide with 4 ounces of saline. And then if you're using the 36%, use a 1/4 teaspoon with 12 ounces of saline, right? So just, do the math on that to get your ending 1% concentration. Again, you can dilute that down more if you need to, but that tends to be the most well-tolerated area. Now, some of the top doctors that recommend nebulizing, I recommend this book, Hidden Epidemic, where Dr. Thomas Levy talks a lot about oral infections. This is where he goes into nebulizing hydrogen peroxide. And then, of course, Dr. Joe Mercola and Dr. David Brownstein as well have been talking a lot about nebulizing hydrogen peroxide. So Brownstein even has his own protocol, the Brownstein Protocol, where they'll nebulize a hydrogen peroxide saline mix with 2 drops of 2% Lugol's iodine, which you can find on Amazon. And if you feel fine with that, you can increase your dosage to 5 to 6 drops of the iodine. So you start small, gradually build up. The Lugol's has potassium iodine. I personally recommend using a pure nascent iodine instead, right? Just kind of a pure iodine, doesn't have the potassium in there. And I prefer doing 3 to 6 drops of the nascent iodine, which we use is the detoxidine iodine, which I'll have a link as well below this video or in the article that you can check out as well, to your hydrogen peroxide solution, right? And this is the detoxidine, right? Again, pure nascent iodine form. Iodine obviously has a lot of great benefits to it, and it's also very antimicrobial, right? So it adds in with the hydrogen peroxide to help kill off pathogens and to slow the growth and replication of different pathogens, right? So it can be really helpful. Another option that you can use is silver. Silver is positively charged. It interacts with the microbial DNA, causing a failure of replication. Now, it's the silver ions, not the silver particles, that are responsible for this effect. So the silver ions bind to the microbial cell wall, right? So it's very antibacterial, binds to the cell wall. And you know, basically, whenever you have a respiratory infection, there may be a viral component, but there's always bacteria around the epithelial membrane of the lungs. And if there's inflammation that's damaging that epithelial membrane, the bacteria will seep in and they'll cause more damage. Bacteria's job is to break down decaying matter, and that's what they're trying to do. So if our epithelial membrane of our lungs is breaking down, we really need to support it. We need to reduce the overall microbial load, and silver does that because, again, it causes the bacterial cell wall to rupture, and then inside the cell, it stops, you know, it binds to key enzymes that are needed to help produce energy within the cell. So now the cell can't produce energy, and then it binds to the microbial DNA strands and blocks the replication process. So it blocks cellular reproduction, right? So this is key. And it also has antiviral effects as well. Silver does. So this is another option. You know, if you've got silver, you follow these directions. I recommend like a nano, you know, you can use a colloidal or a nano silver. You don't want to use homemade silver as the particles are just too large. Okay. And actually it could be dangerous. So be careful with that. But, you know, I use our silver spray, which I'll show you in a picture of, which is a nano silver. And you can just basically, it's, you know, you don't have to dilute it. You just put it right in up to the 2 ml mark. And, you know, I recommend 6 to 7 minutes, 3 to 5 times a day. Right. And so again, early on, like early in the early symptoms, it's more effective, right? You don't need as much time. It's more effective. You're able to get over whatever you're dealing with quickly. Okay. Now, preventatively, you can do any one of these things, a hydrogen peroxide. You can do the Brownstein Protocol, where you do the hydrogen peroxide with the iodine, or you could just do silver and do it once or twice a day, just kind of as a preventative measure to help clear your sinuses, reduce the overall viral load, bacterial, microbial load in there, as well as in your lungs, right? And this is a great way to just kind of clean things out. And this is the silver spray. I'll have a link for it. It's a nano silver, so it's extremely small particles, no toxicity effects. And, you know, it's already kind of diluted down in the nano form. So you don't need to worry about trying to create a saline and get the dosage right. Basically, just put it in to the 2 ml mark and then nebulize it, right? And that's basically what you're going to try to do there. Now, another thing a lot of people will do is nebulize glutathione. Glutathione is your body's master antioxidant. And this can be really effective, especially for healing. So not as effective for reducing microbial load, although it will support your immune system and allow your immune system to function better, which will then lower the microbial load. But it's very effective for helping heal from inflammation, damage, and scarring in the lungs. And so the way that you nebulize glutathione is you obviously, you know, you put it in your nebulizer, but you want to use a certain form. And I'll have, you know, there's a specific form of reduced L-glutathione plus that I recommend that's specifically made for nebulizing. So like the only one I found on the market. So I'll have a link for that. Break 1 capsule. You don't want to use like liposomal glutathione on this because that is made for oral, taking it orally. You don't want to use N-acetylcysteine. Those are meant for oral form. So this is a specific form for nebulizing. You break one capsule open, you pour the content of the capsule into the medicine cup of your nebulizer, add about 1 teaspoon or 5 ml of saline solution or pure distilled water, right? So you just put in some saline, let it sit for a bit until the solution looks perfectly clear. Once ready, put the mouthpiece on and begin inhaling. The treatment of 1 capsule lasts about 4 minutes, right? So it'll go pretty quick. And so basically that's what you're trying to accomplish there. And your biomolecular oxygen, this is another thing that you can utilize. And so with this is actually adding in pure oxygen in there, which also will help heal the lungs and heal damaged tissue. So you can use this as well instead of the glutathione. And it's also anaerobic, right? Or it helps to kill, I should say it's not anaerobic, but it helps kill off anaerobic pathogens, right? So it can be antimicrobial as well. Usually I put about 5 drops or so. You might start with like 1 or 2, just see how you're doing, and then go up to about 5 drops in like a 2 ml, thing of saline, or you could do it with hydrogen peroxide, right? To add even more oxygen into the system. Or you could do it with silver. I mean, you could do it really with anything. The biomolecular oxygen works great. So we'll do that. Another antimicrobial that we've experimented with as well with utilizing here is our Formula 2, which has clove and sage and thyme and holy basil, black walnut, right? And we'll start very small, like 1 or 2 drops, right? See how the person tolerates it. Maybe go up to 3 drops because this is stronger. So we, so powerful antimicrobial that you can add in again with hydrogen peroxide. So it's going to work. Sometimes there's some microbes that, are able to escape the hydrogen peroxide, but for whatever reason, some of the compounds, the carvacrol, for example, and the thyme leaf may be more effective against it, right? The compounds in the clove, right? The eugenol and different things like that might be more effective against it. And so sometimes stacking some of these can be helpful. Just, you want to make sure that, again, you're not noticing a lot of burning in your throat when you're doing this. That's a sign that you're doing too much. I've done that before. Doesn't help. So you shouldn't have like a lot of burning in your throat and in your lungs when you do this. You may already have it to start with, right? And then again, you want to kind of moderate your dose. Like if you're starting late and you already have a sore throat, you already have a deep chest cough. All right. You may already have those symptoms to begin with, but it shouldn't aggravate it. Okay. So that's what you don't want is aggravation. So you want to tighter your dosage to where you're not aggravated, but instead that you are feeling better. So anyways, I'll have a link to that as well. The Formula 2. And then if you are looking for something, orally to support you, we have a great product called Breathe Support, which is amazing. It's got a whole bunch of different compounds in there. Cordyceps and bromelain and boswellia and things like that really reduce inflammation, particularly in the lungs, and acetylcysteine, some different things like that help support and reduce inflammation. And acetylcysteine is really good for reducing mucus formation, right? So it helps kind of cut into the mucus. Same thing with the boswellia. They really cut down on the mucus and support overall respiratory health. So guys, check out the products. And if you're on our store and you're checking that out, just use the coupon code Jockers10 at checkout, and that will save you 10%. And remember, also, this information is for informational purposes only. We're not trying to treat, cure, diagnose any specific disease. Obviously, you guys know that. We're not making any medical claims here, but these are all supportive strategies that you can utilize to help improve your health. So guys, be sure to hit the like button, subscribe to our channel if you haven't already, and share this with the people that you care about. Thanks so much. And we'll see you guys on a future online training. Be blessed.